Olive, she is a lot. She's fantastic, very smart, witty, very funny, and full of energy.
Mila was adopted from birth, and from day one, we've always talked to Mila about being adopted. And one of the things I tell her over and over again is, your birth mom was your life mom, but I am your love mom.
Gabby is her own person in every sense of the word. She literally beats to her own drum and her own parade, and nothing stops her. Early on, you just think, okay, we can just process this and life will go on. And then you realize, well, where her brain tumor is located, that's not so easy. And so surgery cannot get all of it.
Olive went into treatment, and she actually went through multiple types of chemotherapy over a number of years.
Over 11 years of Mila's life, she has had 2 major brain surgeries and has gone through 4 different types of chemotherapies.
Over the last 7.5 years, Gabby has had multiple brain surgeries, chemotherapy, and a targeted treatment.
It was brutal to watch her lose her hair. It was brutal to watch her get sick. It was brutal to watch her get poked all the time. We call them pokes, right? But she would get IVs.
Olive's team came to us. They all entered the room, and they acknowledged that her tumor was growing, and it was time to have a hard conversation about her treatment going forward.
And they told us, we are really sorry, but it has grown back, and it's grown back fast.
After we got the scan results and there was growth yet again, we sat down with her care team and really had that difficult discussion of what options are next, what's available, what can we do.
That was when we were told about an investigational drug therapy that is now called Ojemda.
What is Ojemda, tovorafenib? Ojemda is a prescription medicine used to treat certain types of brain tumors, cancers, called gliomas, in people 6 months and older. That is a pediatric low-grade glioma, LGG, and that has come back after previous treatment or has not responded to previous treatment, and that has a certain type of abnormal BRAF gene.
I remember Olive's doctor outlining all of the information, but she was so excited, so enthusiastic. It was really hopeful.
So when we have to make a treatment decision, we have a lot to weigh. There's potential benefits, side effects, there's our schedule. Just a lot goes into making those decisions.
What are the possible side effects of Ojemda? Ojemda may cause serious side effects, including bleeding problems, hemorrhage, skin reactions, including sensitivity to sunlight, photosensitivity, liver problems, slowed growth in children. The most common side effects of Ojemda include rash, hair color changes, feeling tired, viral infection, vomiting, headache, fever, dry skin, constipation, nausea, acne, upper respiratory tract infection.
Make sure that you are asking the questions that you need answers to so that you feel safe and you feel educated and you can advocate for your child.
Remember that you have a voice in this process. You have an opportunity, and you have one patient.
Like, how long do we have to be on this drug, and how long is this going to be in her system? So to know that this trial was only 2 years, and then we'd be able to stop and reassess, that was super comforting. And this medication was actually designed for kids. That meant it wasn't an adult dose adjusted down for children, but it was actually truly a medication that was designed and tested in kids.
Every decision that we've made along the way has been in collaboration with Olive's care team.
We absolutely trust our care team. They had never steered us wrong.
And they were excited. That helped us feel just a lot more safe and calm about the decision we were making.
We spent some time, we went home, we talked about what our options were, and we started to really think about Ojemda and started to kind of come to a thought that this might be the right option for Mila.
Gabby took her first dose on October 31st, 2021. And that really started our journey with this new window of hope.
Olive started in December 2021, and like we could kind of dare to be a little more hopeful about where this treatment plan was going for her.
Indication. What is Ojemda, tovorafenib? Ojemda is a prescription medicine used to treat certain types of brain tumors, cancers, called gliomas, in people 6 months and older. That is a pediatric low-grade glioma, LGG, and that has come back after previous treatment or has not responded to previous treatment, and that has a certain type of abnormal BRAF gene. Important safety information. Before taking or giving Ojemda, tell your healthcare provider about all of your or your child's medical conditions, including if you have bleeding, skin, or liver problems, are pregnant or plan to become pregnant. Ojemda can harm your unborn baby. Females who are able to become pregnant, you should use effective non-hormonal birth control, contraception, during treatment with Ojemda, and for 28 days after your last dose of Ojemda. Males with female partners who are able to become pregnant should use effective non-hormonal birth control, contraception, during treatment with Ojemda, and for 2 weeks after your last dose of Ojemda. Are breastfeeding or plan to breastfeed? Do not breastfeed during treatment and for 2 weeks after your last dose of Ojemda. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Taking certain other medicines can affect how Ojemda works and may increase your risk of side effects. Ojemda may also affect how other medicines work. What should I avoid while taking Ojemda? Limit the amount of time you spend in sunlight. Ojemda can make your skin sensitive to the sun, photosensitivity. Use sun protection measures, such as sunscreen, sunglasses, and wear protective clothes that cover your skin during your treatment with Ojemda. What are the possible side effects of Ojemda? Ojemda may cause serious side effects, including bleeding problems, hemorrhage, are common and can also be serious. Tell your healthcare provider if you develop any signs or symptoms of bleeding, including headache, dizziness or feeling weak, coughing up blood or blood clots, vomiting blood or your vomit looks like coffee grounds, red or black stools that look like tar. Skin reactions, including sensitivity to sunlight, photosensitivity. Ojemda can cause skin reactions that can become severe. Tell your healthcare provider if you get new or worsening skin reactions, including rash, bumps or tiny papules, acne, peeling, redness or irritation, blisters. Liver problems. Your healthcare provider will do blood tests to check your liver function before and during treatment with Ojemda. Tell your healthcare provider right away if you develop any of the following symptoms: yellowing of your skin or your eyes, dark or brown tea-colored urine, nausea or vomiting, loss of appetite, feeling tired, bruising, bleeding, pain in your upper right stomach area. Slowed growth in children. Growth will be checked routinely during treatment with Ojemda. The most common side effects of Ojemda include rash, hair color changes, feeling tired, viral infection, vomiting, headache, fever, dry skin, constipation, nausea, acne, upper respiratory tract infection. Ojemda may cause fertility problems in males and females, which may affect your ability to have children. These are not all the possible side effects of Ojemda. Call your healthcare provider for medical advice about side effects. You may report side effects to FDA at 1-800-FDA-1088. You may also report side effects to Day One Biopharmaceuticals at 1-877-204-2820. Please see full patient information, including instructions for use, for more information.